Hi everyone, welcome to MD-VOD, your health live and on demand, here on emPOWERme.tv. I'm Dr. John Kennedy, and today you'll learn about diabetes, a disease affecting millions of people of all ages, costing Americans almost $200 billion a year. And whether you're a mother, a father, a child, or a celebrity like Halle Berry, you may be at risk. As we do with every illness, we'll help you understand diabetes and describe what it actually is, who's at risk, the common symptoms, how it's diagnosed, and available treatments and therapies. We'll also discuss the consequences and realities of living with diabetes, including insurance coverage and related costs. Later, I'll be joined by Dr. Cindy Williams, one of the leading experts on diabetes, who will answer your questions live in the studio. So join us as we simplify this potentially deadly disease and arm you with the information you need to combat diabetes for yourself and your loved ones. Welcome back to MD-VOD here on emPOWERme.tv. Today we're talking about diabetes. Let's begin by asking what diabetes actually is. Simply put, diabetes occurs when blood sugar levels in the bloodstream rise above normal. When we eat, our blood sugar rises, causing a release of a hormone in our pancreas known as insulin. This helps our body store blood sugar and use it for energy. Diabetes occurs when we lose the ability to store blood sugar. There are two types of diabetes. Type 1 diabetes is when we have no insulin, and type 2 occurs when we don't have enough insulin. In both cases, our blood sugar rises, which causes symptoms and a number of health complications. If untreated, it can cause a variety of complications in a number of organs, including the eyes, which can lead to blindness, the brain, resulting in stroke, the heart, which can cause heart attacks, the kidneys, leading to kidney failure, and our blood vessels, resulting in limb loss. So who's at risk for diabetes, and why do we care? Nearly 30 million people in America are affected by diabetes, which ranges from infants to the elderly, male, female, and any ethnicity. Again, diabetes is a serious disease and is the 7th leading cause of death in the United States, the leading cause of kidney failure, the leading cause of lower limb amputations, the leading cause of adult blindness, and as I mentioned, it's a major cause of heart disease and stroke. So make no mistake, this disease is a major health challenge to many individuals and families around the country. Common symptoms include blurred vision, fatigue, constant thirst, frequent urination, and nausea and vomiting. Now that we understand what diabetes is and who's at risk, joining me to discuss this debilitating and potentially devastating disease is esteemed colleague and brilliant endocrinologist, Dr. Cindy Williams. Welcome back, everyone, to MD-VOD, and thank you so much for joining us. Dr. Cindy Williams is here, and let's get to it, Cindy. How do we diagnose diabetes?
John, diabetes is very simple to diagnose. You need to see your physician and have a simple blood test. In the office, the physician can give you the answer right there as to what your average blood sugar is.
So it's just a simple blood test?
It's a simple blood test. You can even do a simple urine test if there are more budget constraints.
Oh, okay. And once we diagnose diabetes and we know that's what's the cause of all these symptoms, how do we treat it?
John, we treat diabetes in partnership with your healthcare team. The most important thing is that the patient becomes their own advocate and learns as much as possible about diabetes. We treat diabetes with lifestyle changes, which is the most important thing. And then, of course, we have many tools available in the form of medications.
So we start with your diet and exercise, and then in addition, we add medications. Is that right?
Absolutely, although the trend now is to start with diet and lifestyle and a medication depending on the initial blood sugar reading.
Okay. And I know that there's a type 1 and a type 2. If you don't make enough insulin, what types of medications do we use for that patient?
Well, for type 1 diabetes, which is a deficiency in insulin production, we use insulin replacement. Okay. For type 2 diabetes, which is more of an insulin resistance issue and an inability to use your insulin correctly, we usually start with oral medications.
Okay. And what are some of the most common examples you can think of?
Well, the common medications are sulfonylureas or secretagogues, glyburide, glipizide. We also use metformin, also commonly called glucophage, as first-line treatments for diabetes.
Okay. And then once you've been diagnosed with type 1 diabetes, how are those patients treated?
Well, type 1 diabetes, those patients present often with very high blood sugars, and they usually need to be started on insulin right away.
So Cindy, that's incredibly helpful information. Are there any side effects from these medications?
Of course. The number one side effect for blood sugar lowering medications are that the blood sugar drops too low, which is called hypoglycemia. So we really educate our patients about how to be aware of low blood sugar reactions.
Okay. And what do patients normally feel when their blood pressure or blood sugar drops too low?
Well, when your blood sugar drops low, typically someone will feel sweaty, they'll feel shaky, and they'll feel hungry. And the key is when they drink something like juice or soda, which immediately raises your blood sugar, your symptoms resolve.
Wow. You know, Cindy, the cost of diabetes is enormous. It's estimated at $174 billion annually. And medical expenses for people with diabetes are more than twice that for people without diabetes. Luckily, most insurance covers doctor visits and diagnostic tests that we've discussed with Dr. Williams. Though make sure you check with your carrier about what specific drugs are covered. And Cindy, is there anything that you can think of that might decrease our cost for diabetes?
Absolutely. The most important thing, John, for treating and reducing the cost of diabetes is to not ignore diabetes. Be aware of your diabetes, be your advocate. The goal is to treat your diabetes aggressively early on. The cost of treating the complications of diabetes is tenfold than treating the diabetes before you have complications.
Wow, so an ounce of prevention really is worth a pound of cure. I'd like to thank Dr. Cindy Williams. That was just outstanding advice. Thank you so much.
Thank you, John. Thank you.
Up next on our Apple a Day segment, learn how you can prevent diabetes from occurring or lower your medication requirements and prevent complications if you've already been diagnosed. To prevent diabetes, or even if you've already been diagnosed, regular exercise is key. You should talk to a doctor first about an individualized routine, though exercise is great for diabetes because when we exercise, our muscles use sugar or glucose for energy, and regular physical activity improves our body's response to insulin. And both work together to lower your blood sugar level. In addition to following your regular exercise and diet routine, make sure you check your blood sugars and take your medications on time. And also check your feet for sores or any wounds. It'll definitely prevent complications, and it could actually lower your medication requirements. I'd like to thank our expert, Dr. Cindy Williams, for joining us and for sharing her expertise and for helping us further understand diabetes. If you missed any of today's show and have any of the symptoms we discussed, make sure you consult a healthcare professional and visit the CDC website on your screen, as well as emPOWERme.tv, because the more knowledgeable you are, the healthier you will be. Thank you for joining us, and don't forget to like us on Facebook, follow us on Twitter, and join in the conversation. I hope you found this information about diabetes helpful. I'm Dr. John Kennedy. You're watching MD-VOD, your health live and on demand, here on emPOWERme.tv. Thanks for joining us.